Hi there. My name is Dr. Inez Strama, and I'm the Assistant Director of the Student Counseling Service at the Wellness Center here at the CUNY Graduate Center. Thank you so much for stopping by our website and for considering our site as one that you may want to train at. In order to help you get a better sense of whether our site is a good fit for you, I thought I'd answer some frequently asked questions that we get about the program. The first is a basic, can you give us an overview of your site? Definitely. The first thing to know about our site is the students that we work with and the clients that you would be serving. So we serve about 4,000-ish master's and doctoral level students. We are not an undergraduate counseling center, so all of our folks are graduate students themselves in programs ranging from the biological sciences to the social sciences, humanities, and arts. They're an incredibly rewarding group of people to work with. They are extremely intelligent, highly accomplished, impressive individuals who, in addition to being graduate students, as you may know yourself as a graduate student, have very robust lives outside of just their student identities. So they may be taking care of families, they might be parents, they might be teaching, they might have work outside of being a graduate student. And so just really hardworking, dedicated, pretty impressive individuals to work with. In that way, they're also really rewarding in that they will do homework if you give them homework. They will really actively grapple and wrestle with what you're doing together in therapy. They are self-referred, highly motivated, and just a real pleasure to see in treatment. The next thing to know is the kind of services that you would be offering. So the first is individual therapy. We work on a time-limited treatment model, and so you would be seeing folks in 12-session therapies. And I'll talk a little bit about our theoretical orientation in a minute. But in addition to seeing folks in individual therapy, you'll also be co-facilitating a group while you're here, which I'll tell you about in a minute. You'll also be helping folks get connected to referrals. So you might meet with folks for 1 or 2 or sometimes more sessions where really the goal is kind of assisting them to get set up with an open-ended provider in the community, which is a unique training opportunity. The next service that you would provide is couples therapy, if that's something that you were interested in and came with some knowledge of. Which also makes us unique as a counseling center because a lot of folks don't offer couples therapy. So that's a really great offering and something that our students are really thankful for. And then the last service you would offer is outreach in the form of workshops as well as videos with content relevant to our students that you would put on our website. You would carry a caseload of about 5 to 6 individual clients plus a group. And so those 5 to 6 clients may be everything from an individual therapy case to someone in that sort of consultation capacity that I mentioned and supporting them getting connected to a referral or a screening or intake. You might also see someone in an academic consultation. I didn't mention that as one of our services. That's another service we offer. So we see folks for about 4 to 5 consultation sessions and really kind of targeting an academic concern, like maybe a challenge with an advisor or procrastination or writer's block, things like that. As far as theoretical orientation, we really strive to be integrative. And so and responsive. We want you to really leave your training year with us being flexible, being adaptive, and really thinking about how you can show up for your clients in the way that they need you to, moment by moment, session by session, and really widening your toolkit about how to best show up and be supportive. And so what that means is that unlike other training programs that are strictly psychodynamic or strictly CBT, we really do try to give you a wide exposure to different ways of working to kind of, again, help you, kind of walk out of here as a more rounded, well-rounded clinician. So to that end, the first part of our training year is spent on time-limited dynamic psychotherapy, TLDP, where you will learn how to conceptualize from that lens, and you'll be bringing that into supervision and really working to think about how to work with clients from that lens. The second half of the year tends to be on CBT, and again, all in service of sort of integrating those lenses. In more recent years, as we've had folks from training programs around the city where maybe they get a lot of CBT exposure, we have been expanding our program to do more didactics on couples therapy and on group therapy, since those are such big parts of our services. And so that also speaks to kind of our responsiveness. Just like we want you to be responsive to your clients, we really try to be responsive to our trainees and to kind of listen to what they want, what they need, and be flexible with our didactics accordingly. Let's see, the other important piece of our training program in terms of kind of integrative lens is multicultural humility. So we will spend some dedicated didactics on multicultural humility. And it's also just woven in through the fabric of everything that we do. So something that will get talked a lot about in supervision. You'll do sort of an inventory of your own identities, your supervisor's identities, and then we'll ask you to be doing that for your clients. And so really thinking about doing cultural case conceptualizations, thinking about, again, how to view your clients if they're presenting concerns from that lens. And that's important anywhere with any folks. It does feel particularly salient at our site because of how diverse our student population is. So we have about 20-ish% international students. We have folks from all sorts of social class, racial, ethnic, gender, immigrant status, international student status backgrounds. And we're also a school that has a very strong social justice orientation. And we're a city institution, we're a city college. So folks are really studying sociopolitical issues that may be embedded with their own identities. And so that's coming up a lot in therapy. And so it's something that we want you to feel fluent in being able to think about and talk about with your clients. So that's a little bit about theoretical orientations. The other question we get a lot is about supervision. So you will be supervised by one of the internal staff members. There's 4 of us. You'll get an hour of supervision with one of us, and then you'll get an hour of supervision with an external supervisor. And those are folks, many of whom have done the fellowship program actually themselves. So they kind of have a sense of what you would do here. And they carry a whole host of different identities. And then you would also get a half hour to an hour, depending on your supervisor, of group supervision. And that will be with the person, the staff member that you, or sometimes fellow, sometimes if you have two fellows co-facilitate a group, but usually a staff member. And you will, you'll be co-facilitating with them, and so you'll get supervision from them as well. The groups that I said I'd circle back to, that one of which you would be co-facilitating are the Black graduate student academic support group, the Latinx graduate student academic support group, the Asian graduate student the Asian graduate student academic support group, excuse me, the first generation graduate student academic support group, the LGBTQIA+ academic support group, the ongoing challenges of graduate school group, a parenting support group, and a process group, and a dissertation support group. I think that's all of them, but as you can see, we have a really robust group program here, and so that's kind of a big part of our training as well. Let's see, the other questions that we get are about what types of students we're looking for. So who's a good fit for our site? And one thing to know practically is that we are looking for folks who this would be their second year placement or above. So we're not the best fit for someone who's looking for a first year placement. That being said, we certainly take you in as a whole person and think about your life experience, and maybe some different life experiences that you bring, maybe some previous training or clinical opportunities that you've had before you got to graduate school, things like that. So although we really prefer someone who's a little bit more advanced in their second year or beyond, we'll certainly consider those factors in your application. And again, we're wanting to think of you as whole, holistic people in the same way that we want you to think of your clients and our students. As far as other characteristics, and I should say there's a wide range of folks that we get. So we'll get folks who this is their second year, and then we have a lot of folks who are applying for internship this year. So somewhere within that range is usually a sweet spot. In terms of sort of personality characteristics, sometimes we get that question, like what's who would be a good student at your site, a good trainee at your site. I think the things that come to mind are being flexible, because we are really working to expand your sense of what is possible in treatment and sort of different ways of thinking about and doing the work. Someone who's interested in that, who's interested in kind of stretching and growing that way of being a clinician, as well as someone who's really open to growth, and maybe isn't looking for necessarily like a workhorse environment. We really do think about you as a graduate student in the way that we're serving our graduate students. And so we're really wanting to create an environment and foster a culture in which all parts of you are welcome here. And so that means that you're interested in a community and a culture that's going to nurture you and your growth and support you. So I think those are the kind of, and then I guess the last thing is that we really look for candidates who are representative of our student body, who carry both the visible and maybe less visible identities that our students carry. And so, really looking for folks who both are representative of the student body in terms of identities, and also that are eager, interested, hungry to have conversations around intersectional identities, marginalization, privilege, multicultural humility, since those are such core pillars of the work that we do here. And then I guess the last thing that I'll add is that our didactics take place on Fridays. So that's the only one mandatory day and time that you'd be expected to be on site. And so that's on Fridays from 10 to 12:30 p.m. Otherwise, we'll ask for your preferences on the days that you want to be here, and we're usually pretty flexible. In that Friday meeting, that is where our didactics take place. But we spend the first half hour or so of the meeting just checking in with each other, again, in service of building kind of the community culture that we strive for here. And so that means that we as staff check in, trainees check in, and we're really talking about how our week was, not just clinically, but also personally. So we learn about weddings and births and more difficult moments, the challenges of going through the internship match process, for those of you who are coming from psychology programs, also the political strife and wars and other political events that are going on. So, hard things too, that we're all carrying in different ways. But so we really get to know each other, and then that's when we transition into more of the didactic portion. I think those are most of the questions that we get. I think the only other last logistical one that in this current moment comes up is around being on site versus remote. As of right now, our office works in a hybrid capacity. We are mostly providing in-person services, but we do offer virtual services as well. And we're open on site 4 days a week and off-site 1 day a week. That's subject to change. And so if you are applying to be here, you want to come prepared to be on site, in person, even though some of your sessions might be remote when you're here. Okay, I hope that was helpful to you. We're really excited to read your application if you apply and look at your materials. And if you choose not to, thank you for your time, and we wish you the best on your journey. Take good care. Bye.